you will just perform MFR stretching. Hold those for a minute to work your way up or down, whatever you choose. Usually we'll do about 3 different positions for that. Over the elbow crease, right over the meat, or the belly muscle, and then one right up close to the anterior deltoid. Now on this part, if you're stretching up through here, we gotta remember the acromion and the coracoid processor right here, so those are uncomfortable to like drive your fingers into, right? Start inferior, you wanna end cupping them so that you're right over top, so you're not pushing directly down into them before you do your MFR stretch, okay? When it comes to pec MFR, I usually will skip this step entirely. If you want to toss some in, I will generally bring the arm up to shoulder height, taking either the blade of my hand or a fist and just traction that skin away. And because of the position, it's not going to take a lot to stretch. You do it like that. You bring your arm up. You can even do a little torque with it, depending on breast tissue and size and all that. And you can even pull inferiorly away from the clavicle if you prefer. But that's entirely up to you. I skip it because you can achieve so much without having to do all that. Then we're gonna go right into, we would skin roll all the way up the arm. We've already covered this. Making sure to pay good attention to the anterior deltoid through here too, to make sure that this will soften up. So we're just gonna do a little unraveling to make sure we're good. Yeah, we're gonna be fine. But I definitely do not do any skin rolling to the pecs. I don't think they're gonna be good without much right through here though. Okay, we're gonna loosen up the biceps real fast. Right on into our deep stripping. You guys have seen all of this stuff before. And pressure-wise, a little more or less, you okay where you're at.
You
How
can do
much-
more.
Sorry.
No, you're good.
How much, like,
Use your words.
like, they're somewhere deep inside there. I'm trying to find them. So like locked long, locked short.
Yes.
Where the pecs are locked short. How much of an effect does that have on like an individual's breathing?
It can, quite a bit. I mean, because if you're internally rotated, you're naturally going to kind of go into a little bit of kyphosis. So you're definitely restricted.
Okay.
It's not this nice open full breath that you can take, because also there's mainly the curling of the spine, because you're never going to get back to that big, tall, open chest and open spine breath, because once that becomes structural, your breathing will be inhibited a little bit indefinitely.
So my next question would be, when you have the client in this position, would it be a good idea to encourage some of those, like taking the deep breaths to expand that chest cavity?
You always want to see the abdomen rising and falling, always.
Someone has a kyphotic spine, do you bolster them at all if you're doing this?
Unless they're having neck pain, then sometimes I'll do like a little neck bolster in here or the back of the head to just keep them
So you would
where they're
need to
used
kind
to.
of open it up and rotate the
Yeah.
shoulder off. Okay.
No, you can usually achieve it without all that. Now we're gonna go right into the anterior deltoid. And this is where you're gonna slow down just a little bit, because we're gonna be feeling right here. You can actually see doop, doop, bicep tendon. So go very slow, little friction all through here as you open the rest of this up. And you should start being able to feel how the pec crosses over underneath here.
So it's underneath the bicep.
Yeah. and we'll do our little scoops.
Do you ever see any coracobrachialis involvement in that? They're like kind of fighting against the pec minor?
I wouldn't say fighting against it, but I mean, yeah, there's always the potential for a little bit of tension in that muscle if you've got pecs and other stuff going on.
Yeah.
Do I find it to be a really big issue? No, not at all. I'm gonna leave this right here, Robin. Okay, so now, once we've got all this loosened up, we've made it all the way through to step 3. We've finished all of that, okay? Now we're on step 4. Because steps 1 through 3 are literally just the bicep and anterior deltoid routine. Now, going into the actual pec major. So this is the amount of space that we've got to work with here, okay? And what we're gonna do is we're gonna use a little bit more lubrication than we normally would, just like we do on the biceps and that inner portion of the arm. And I'm just going to pull away. Get that thing out the way. And I'm just going to pull from the sternum, inferior to the clavicle, all the way over. You'll feel the coracoid, coracoid process. Scoop around that to allow yourself to pass over to the anterior deltoid. And I'll do these nice lines all the way down. So pulling, stripping the pec, scooping around the coracoid process, down the anterior deltoid, down the brachium. And what this does is this is just the warming up steps. And you're gonna be working more inferior as you go. Another little useful technique, your pinky and your blade of your hand on your inside hand is a great tool for continuing to pin whatever breast tissue is there down so that you don't have to worry about that being exposed. And I usually will do these little cross fiber, radial ulnar deviation, if you will, as we strip all the way along to get everything warmed up. And you can already see, without doing MFR, we've got some blood flow increased. So we've already got a little bit of localized hyperemia. Once you've done that, which is step 4, single hand, one hand, double stack fingers, whatever you prefer, to deep strip, this is where the money move comes in. So, 90-90, just like that. Now, on this, what you're gonna really want to do is have your client relax their arm directly through here. If they've had a rotator cuff repair or anything like that at all, you're gonna wanna check internal and external rotation, which they should be able to achieve 180. So there's 180 this way. A little bit of stiffness right there. So our goal is to take this and we want it to passively externally rotate to this position. So we've got probably 10 degrees left. So we don't have too much on Robin to really worry about here. So I'm gonna use a little bit more lubrication. I had like 200 milligrams of caffeine today, so bear with me. Now this position is gonna take, this is an acquired taste, kind of like beer. So you've really got to get comfortable with the movements first. So I'm gonna support right above the elbow. This will be my treatment hand, and it will also be the hand and the arm that internally, externally rotates the arm, while I adduct and abduct with the bottom one, as well as move this arm up into further flexion, okay? So then you got some crazy moves that you can use to strip these muscles. You can also go from lateral to medial if you prefer. And all the while utilizing as much movement as you reasonably can to feel how that tissue is changing underneath your fingers, okay? So see, and it doesn't, you don't have to do the full big crazy movements all the time. Little wiggles go a long way. Do I repeat myself sometimes?
No, I say that every class.
I know I
It just
do.
sounded like it fit.
I know I do.
It's great.
If it ain't broke, don't fix it.
Little wiggles going on.
And then as you're doing these, you're really gonna be taking note of where all of the tension is that you're experiencing. Which on Robin, we can tell this lateral portion, the most inferior border, is pretty tight, which is gonna lean us into getting into pec minor a little bit later. So we're continuing to strip the entirety of the pec, utilizing both directions. And then also, once you get to the point to where you need both hands because you need a little bit more pressure, the inside of your forearm and your elbow will take over the job of flexing that arm up and bringing it back down. And then we'll work our way all the way over there to the sternum and drag and pull all the way back. And now we've started to get this to kind of loosen up a little bit.
I was gonna say, when you're just starting to feel resistance, is that when you start to AB and AD up?
Yes, exactly. Because utilizing that movement helps these muscles soften and remember their range of motion. And now if I let go and I don't do anything passively, that's like 178 degrees. So, and this is before we even got into pec minor, okay? So, resting your crease, these were steps 6. And now we're gonna go into 7. Utilizing pincer compression, we're gonna isolate the lateral border of pec major and perform a pinch and stretch by a combination of internal, external rotation, and abduction of the glenohumeral joint, making sure to not go beyond 180. So this looks like so. Sometimes you might have to actually lift the arm up to get some slack. Are you ticklish at all? Okay, good. So then we're gonna sink on in. I've got that pec from immediately, here's the clavicle, immediately inferior to the clavicle to that lateral most border. Then you rest back down. You can use both hands, and basically, I'm gonna let my pinky fly here. So, squeezing on in. And if you just want to pinch or compress, you can do that. But the pin and stretch that I'm referring to is when you squeeze in, and then you utilize that shoulder movement as you glide that pinch or compression. Still doing okay pressure-wise? And if the muscle is too dense, or if you're not able to get enough pressure with one hand, go to both, and just don't worry about the movement for right now. This is where you'll just focus on internal, external, because getting into this position is a little weird unless you want to scoop under and do it like this, which I personally am not a big fan of.
Because it's sensitive?
Well, no, we're about to do this, but just in this position, it's just, this to me is not worth it, where appropriate pressure here and this is.
Okay.
You can also pull your hands apart. And this can be pretty darn intense, so be kind. But I can already feel there's one area right here, right on that lateral border just before it comes across and touches it. Is pretty tight. So we're going to do tensor compression treatment here. Pressure inferior towards thorax, blah, 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 blah. Okay. So, let me know when you get too close to that mild discomfort.
Okay.
Perfect. I want you to take 3 to 6 good deep breaths for me, really slow. And as they exhale on trigger point treatment, I'm going to slowly let that arm relax. There we go. Do 2 more breaths, and on those exhales, I'm slowly going to decrease my pressure and friction on the way out. And then I'm going to do those little scoops around the coracoid process. And now for step number 8, we're going to try to go into pec minor. So you can toss in a couple other little things here and there if you prefer. If this is not working for you, the stripping, if you can't get enough pressure, supporting that entire arm, supporting underneath the axilla, and taking your thumb, compressing right on in. Then you can work it with this arm. Is another way to go about this. Personally, I find by this point in a session, my thumbs are starting to tax out a little bit. So I want to use other treatment tools. So to go into pec minor, we have to go underneath pec major, right? So, a couple good deep breaths for me. And as Robin inhales and exhales, I'm going to pin this pec away from the muscle, so I'm lifting it up. And once I can get in there, underneath, taking our fingers, and I'll usually take my thumb and scoop underneath here. Bring the arm up, slowly sink in. When you get to about mild, just let me know, okay? Right there. And if you feel any numbness, tingling, or any shooting, jolting pain, just let me know. Right now I can feel the pec minor compressed right into the actual thorax, okay? If I strum, I feel it come off. My fingers are coming off the tip of it. So staying back, in, compression, then you can work the arm some more. This will act as your pin and glide or your deep stripping effleurage as you compress in, AV duct, and strip. And then on your exit, you're going to gradually decrease pressure without movement. If you find any trigger points in there or anything like that, stick around, treat it. Also, once you get enough slack in the pec major, Robin clearly did some push-ups and made some pecs for us, as he said he would. So if you're struggling with, or if you're not having any issues or resistance, you can go straight through the pec major and treat pec minor. Personally, I find it more effective to scoop on up and under, get close to that coracoid attachment, strip it down these lines deep. If I'm not doing that, I'll usually go into a standing position, taking my fist, find the coracoid process first, so you know where that's at. That's not a trigger point. Taking my knuckle and placing it just inferior to the coracoid process, gently compressing in. Let me know if you get close to mild. And then I'm just going to let this arm internally, externally rotate.
So that's only if you can go through.
Yeah.
Pec major.
You can also AV duct and do the same nice little movements.
Where are the lymph nodes that are around there? Where are the lymph nodes?
All over the place.
That's
Yeah.
another thing just to be aware of.
Yeah, if you feel little tic tacs in there that are squishy, it's probably a lymph node. You can also just supinate your hand in this treatment technique too. And pull the opposite way, laterally. And then we'll gently lighten up. The friction part of this is often overlooked for people. So this is step number 9. Yeah. So on here, you can feel the sternum, you can feel the clavicle, and I'm going to focus kind of like a half moon of what I can palpate all the way across. So sternum, immediately lateral, rib cage, I can feel them. The friction should be firm but very gentle at the same time. So you just want enough compression so that they can feel it. We're not moving a whole bunch. You'll reposition as you go all the way along that clavicle. Again, we're going to move about the width of one of your fingernails each time you move and reposition. Doing so will make the client feel like they're getting everything treated and that there's nothing that you're leaving out. And just so you guys can see, I'm just literally stacking my fingers right here. And I'm kind of taking this finger and curling it up underneath the clavicle to make sure we draw that fascia down.
And you started over here by the sternum.
I started right along here. Some people you'll be able to access more of that forward. Personally, I'll try to be as modest as I can on draping and stuff. Just to make sure we respect our client's modesty. Because there will be some people that have none.
Like the lady
As Christine shakes her head.
like the lady
It's
who
always
started
the old
to
ladies.
undress with me in clinic.
It's
I was
always
like,
the old ladies.
I mean, I relate. And once you give them birth, I'm telling you.
yeah,
it's
you
kinda-
really don't.
Kinda like all that goes on.
I mean, it seems fair enough, I get it. It's like,
And when you come over to the coracoid process, you remember that little half moon thing we did? Same thing. Continue that arm. You'll scoop. And then we're gonna add in some, it doesn't say it on it, right after friction, you can go ahead and toss in some more open palm effleurage, just lightening up each time, just to make it nice. And then to close out entirely, at this 90 degree, the other thing you can note too is as you progress your treatment, you're gonna get the arm all the way up to here, into this position, so that we get to 180 degrees. So this takes time, and you'll switch your arm at this point and just strip on down this line. This is the goal. Get them all the way up to here with no pain or anything like that at all. You can also scoot behind right into pec minor this way too. But this will allow you to strip to the maximum capacity. And when we do lats next week, squeeze right on into the lats. Some people are gonna stop right here, and that's okay. We still want to try to get them as far up as we can. And I don't need this arm to be this perfect. You can't allow that arm to internally rotate and come over. Just make sure to watch your drape when you're doing that. But to close out, traction of the arm. So I'm going to support about halfway up the brachium, just inferior to the deltoid, and right here. And just a little lean is all it's gonna take to traction that arm. And it really does feel good. If you wanna go the extra mile, you can kind of strip tricep and the bicep as you do this. But for me, I've already done all that, so I'm not going to anymore. Sorry, Rodman. And then you can relax really slow. Bring them down from 90. Or we'll call that, we're gonna call that 90. To about 45. And then this one, some people will struggle with this one. I'm not exactly sure why. The more skin contact you have from your client, so if the forearm's on here, the better. Up and underneath here, you can get kind of tender as you're cranking down. So to watch for that, just grab the forearm, and this arm will be more support, and then just lean. And with all the skin contact you're getting from the forearm, you'll be able to traction really easily. And then I just lighten my grip, and that is what returns the arm for me. Then down at 0. And this one, I will usually stabilize the shoulder or depress, or not depress, retract that scapula by pressing on the AC joint and hook into the clavicle. Draw that arm straight down. And then we'll release your grip really slow, and that will return their arm back to where it needs to be. But after that, you can see pretty darn close to 180 after that. We started kind of right about here, got to right there. After one treatment, I'm happy with that. Now, repositioning at the head of the table. Okay. So for this, your outlaw bandana is going to be a problem.
We get a mask from the front desk.
Yes, sir. Yes, sir. We might, because I'm going to have to rotate his head.